All right, so some of these will be shorter than others, and some will actually be combined. This is going to be one of the shorter sections. We're talking about the hematopoietic system, and that's making blood cells. Remember that the fetus actually begins making blood cells in utero. Red blood cells and hemoglobin. The fetus actually has more red blood cells. That's part of the reason they're able to function with lower oxygen concentrations. But red blood cells with fetal hemoglobin have a shorter lifespan, so they die off more quickly. If a fetus is born full term, they usually have iron stores to last about 4 to 5 months, because remember, they're storing iron during those last months of pregnancy. Fetal red blood cells, remember that they have a shorter lifespan. That breakdown in the first few days contributes to physiologic jaundice. Over the first few months of life, the fetal red blood cells are broken down and replaced by red blood cells with adult hemoglobin. Leukocytes, some increased white blood cell count is normal at birth because of the stress of birth. But even though they have higher white blood cell levels, the leukocytes are not very effective at recognizing and fighting pathogens. So newborns don't have extremely effective immune systems. That also means that they don't show as clear symptoms when they have an infection. So we have to be able to monitor, we have to know how to assess for infection in a newborn. Platelet count is similar to an adult, but there are a lot of clotting factors that are low, because remember that vitamin K is essential in building those clotting factors. Vitamin K is synthesized in the gut, and normal gut flora, normal intestinal flora is necessary to that. The newborn gut is mostly sterile, or is sterile. And so they're not making vitamin K yet. They have a vitamin K deficiency. Because of that, there's a risk of something called hemorrhagic disease of the newborn, in which a newborn has uncontrolled bleeding. And that can be anywhere, but the most devastating is if it's intracranial. And so we give vitamin K injections at birth. Blood types are genetically determined. Cord blood is collected at birth in order to determine the newborn's blood type. Okay, so I told you this one would be short. The next section we're going to talk about is temperature.